she can half an apple. So she can basically get an apple in half by hands, exactly half. No knife. So, yeah, and she can also move her eyes independently of each other. So maybe we can see something like that. Okay, great. So, Miss Gardner, welcome. Thank you so much. I didn't know whether I should share that fun fact about my eyes because it's not very pretty. Thank you for having me here today, and it's so nice to see so many familiar faces. I'm going to be talking about the nuts and bolts of PRRT, but basically it's the patient journey of what it would be like for you to go through this with us. Obviously, I work at UCLA, and I've met many of you there. My overview, I'm going to talk about, sorry, so, is that better? Sorry. About Lutathera, an outline, what to expect, the treatment day and infusion, side effects, instructions, also the radiation, and finishing off for infusions. So what is it? What is Lutathera and PRRT? Well, it's a treatment that uses targeted radiation to kill cancer cells from within. It's comprised of a targeted molecule that binds to specific receptors, specifically somatostatin, the subspecialty ones of SSTR2 that are found on the tumor cells, and then the radioactivity is internalized to kill that tumor. It was approved in January 2018 and had very, very favorable results from the NETA-1 trial. I have stole this slide from Dr. Auerbach, who is speaking next, but this is a good image of what it looks like. When you do an imaging scan under nuclear medicine to try and find your tumor, they look at the somatostatin receptors and they have an imaging component. We take that, well, personally I don't, but Novartis does. They take that connection there and then they apply the actual lutetium to where the imaging receptor is going to internalize into the cell. And Dr. Auerbach will speak more about that. So what does it look like when it arrives? It's a solution that's in a vial, and it's a clear solution. It goes through a vein. We receive it from a radiopharmaceutical company in a lead pig. It's given with secondary infusions to help with nausea and kidney protection, and it is given in a hospital setting. All right. And the outline of what that looks like is it's given in a total of 4 infusions with 8-week intervals, plus or minus a week within that schedule. We coordinate it with your somatostatin analog injections. So we can maintain you on a 4-weekly schedule of those injections, and then every 8 weeks you'll receive the lutetium. Now, we like a washout period of the somatostatin analog, about 28 days before we give you the Lutathera. So the injection of your analog will be coordinated after the infusion, and then 4 weeks again you'll have that SSA injection, then you'll receive the treatment, and then straight after the treatment your SSA analog. So we can keep you on that schedule moving forward. The dose is a standardized dose. It's 200 millicuries each time. There's no change in that dose unless there is issues with how your blood work comes back, and I'll speak about that a little later. So who receives PRRT? You've heard a lot of the physicians this morning speak about grading, imaging, results from your Ki-67, that it's given to people with GET-NETs for grade 1 and 2 well-differentiated tumors. So we have tumor boards where we look at patients when they come through, and they were speaking about sequencing today. When we bring in PRRT or surgery or interventional radiology or medications, there'll be a tumor board that will discuss your cases together, and then you'll come for a consult to nuclear medicine if they think that the sequencing time is now for PRRT. You'll meet with a nuclear medicine physician. They will review the images with you and show you your images and speak to where we can target the tumors that lit up on the nuclear medicine studies that you had. They'll review your CT imaging and also your biopsy results and speak about how this treatment will be given, the side effects, and what that schedule of events looks like, and what it'll be coming to the department and going over some basic instructions. So you'll get a lot of information at that consult. We also give out information at that consult from the physicians. We give out discharge instructions, a consent, a schedule of events, because there's a lot of information to take in. We want you to take that home and we want you to read it. And also there'll be contact information given if you have any additional questions to follow up with. And also a financial line and authorization, because that's another big part of the process of when you're getting scheduled for this kind of treatment. It has to go through an authorization process as well. And that can be very, you've got to be very mindful of that moving forward, because authorization and coverage is a big part of what that treatment process looks like. Also, there's a schedule of bloods that we'll take during that treatment process. We will monitor complete blood counts, chemistry. That will be every 4 weeks during this treatment process. And a week before you receive the next treatment, we want to make sure that we're monitoring for toxicities with this treatment that we give you. We want to look at your red cells, your white cells, your kidney function, to make sure that you're within range to receive this treatment and continue receiving that treatment. If there is any changes within those blood work results that we get back, there is options within this schedule where we can either delay treatment or reduce the dose. Those are things that will be tailored to your care specifically when you're in this treatment receiving it. If there is changes within the blood work, they usually do resolve within 6 to 8 weeks before you receive the next treatment cycle that comes around. But we will monitor that and tailor it to your care going forward. So what to expect prior to therapy. And this may vary institution per institution, but we all try and guide you the same way. Some may have little nuances one way or the other, but we just want to make sure that we're looking after you as a person and your family. With the information that you receive, we will answer questions. It's like there'll be certain things given out, like we have to have you bring a change of clothes. A lot of people say, well, why am I getting into PJs, getting into a bed? It's really for contamination. We don't want you to go home in hospital attire. We want you to have your own clothes to go home in. So we ask you to bring those with you in case we need to change you. We may not have the Depends that you wear if you're wearing Depends. So it's good to bring that with you. We may not have your pain medication that you receive. So we want you to bring everything with you that you need to make your experience comfortable. And also, we like you to have somebody drive you there that day, because we don't know how you're going to feel after the treatment on the day. We don't know whether you're going to feel a little nauseous, you're going to feel a little tired, it's going to wash you out. So for safety, we'd like somebody to drive you there the first day. If you're okay with that, then the next time you come down for treatment, then you can drive yourself. So a lot of the questions we get are based on, accessibility, who can come, what you need. And we like to make sure you've got all that ahead of time. I like to make sure that you've also got food as well. We don't provide lunch, but we have light snacks and also have a light breakfast. A lot of people don't realize that, you can eat during the day, but we don't need to have a big, robust breakfast. We'd like you to have something light, just so that you're not too hungry, just to see how you feel. I also put a few pictures in of the treatment room, because a lot of people think, what does it look like? Because they've had infusions before, they've had chemo. So how does this differ from that? So our treatment rooms are set up. We do have padding down on the floor. We have a lot of things clean, padded over with sheets for protection. And also the restrooms. When a patient sees the restrooms, they're like, oh my God, what's going on? Do I have to do this at home? And it's not the case. This is just to protect for any contamination. We see a lot of patients come through, and we have to make sure that it's already accessible and easy to clean up if we have any accidents or spills. So that's why our restrooms and rooms are set up this way. Your therapy day, when you arrive, you'll be taken into the room, you'll see the doctor, you'll sign consents if they haven't already been signed, and the infusion is given through an IV. So we'll start an IV in one of your arms, and then we'll give you a pre-medication, which is a nausea medication, and then we'll start an amino acid, and then we'll give you the lutetium during that time. So that's a lot to go on. So what does that basically all mean? It means you're going to be with us for about 5.5 hours from treatment beginning to end. During this time, you can relax, you can sleep, you can talk with the staff, we can go over education points, we can go over radiation safety, education that way. So there's a lot of things we can do, and we can also bring your family in the room to the side and discuss that so we don't have to repeat it again as well. This is pictures of an infusion, the actual Lutathera, lutetium 177, many names. This is actually what it looks like, and that's lasting 45 minutes. The rest of the time is the amino acid infusion. After the lutetium's taken down and you're sitting there just getting the remaining amino acids, we'll be encouraging you to take fluids, to go to the restroom, and there'll be specific instructions that you'll have to be seated at the toilet, male or female, use toilet paper, male and female again, and also wash your hands to make sure there's no contamination aspects that way. If you do wear depends, we'll give you special instructions about the depends and what to do with those, and to wear gloves while changing. Post-infusion, we'll do a wrap-up, we'll give you discharge instructions, a flight letter, travel information, and also we'll measure you at a 1 meter distance to make sure that we can safely discharge you into the community. And all patients are safely discharged into the community. The radiation levels are very low at discharge, but this is something we document for licensing purposes. Your oncologist will receive your schedule of events so they know what's going on, and also the blood work that we're going to do, because we work very closely with your oncologists during this process. And also your SSA can be scheduled anywhere from 4 hours to 72 hours after the infusion, so to maintain you on that schedule. When we look at side effects after this, this is a whole umbrella that could be one of many things. Some patients don't feel any side effects, and the question is that I felt nothing, is this working? Well, yes, it's working, and you're just very lucky that you're not feeling any side effects. Other patients can feel within the first 3 to 7 days fatigue, aches, nausea, abdominal discomfort and cramps, experience more diarrhea if you're a functional tumor. It's very, very wide, and we like to give out a phone number so you've got direct access to speak to somebody or text somebody if something comes up that you think, well, is this associated with my infusion or isn't it? There's a lot of things that are very nuanced, and we'll have to talk that through. Obviously, if you have severe side effects, we'll want you to go to the emergency room, such as if you have a severe pain, which isn't usual, or a high temperature that isn't usual, those kind of things. But we will always have a 24-hour text number, which normally comes through to me, so I can follow up with the patients and we can discuss those side effects or questions moving forward. Waiting is the hard part after treatment. We don't recommend any special diet, any special vitamins. We do ask you to hydrate and also relax. If you want to go back to work, you can. That's absolutely fine if you feel up to it to do so. So how radioactive am I after this treatment? You are radioactive, it's inside you. However, it's a very small amount. We recommend just staying away and keeping a distance of 1 meter from patients from your family members for the first 3 days, and making sure that you just take time to relax and be very careful with any urine products, which is washing your hands, having a daily shower for 3 days. We know from the research that most of what isn't taken up by the tumor is offloaded in the urine. So most of the radioactivity is offloaded in the first 5 hours, about 45%, and after 48 hours, 65% is passed off. So based on these calculations, the first 3 days are what we look at, just to be careful and respectful of the radiation that you've received. So we'll look at the sitting on the toilet, using toilet paper, hand washing with soap and water, daily shower recommended, just so we can wash anything away from after we've been to the toilet, any residual urine. Contact just a few minutes with each people, just standing back. I'd say sort of like treat it like a fire. If you're standing by a fire and it's warm and you're there, take a step back and it's not as hot. And if you are going to stand by the fire, don't stand there for too long, just come back. So in the first 3 days, it's sort of like a little analogy, just keeping a little bit of a distance is good. You do have radiation on board, but it's not at dangerous levels. We just want to be respectful of it and just understand it. Follow-up after your treatment. I think this is the hardest part. You're already receiving 4 treatments 8 weeks apart, and then after the last treatment, we're going to ask you to have imaging and follow-up between 3 and 6 months after your last treatment. So we're looking at a year before you know if this treatment's working. Will you get scans in between treatment? We don't normally do scans in between unless it's clinically indicated. So there's no black and white. We don't say, yes, you'll get a scan after 2 treatments, because it could be maybe after the first or the third, or you may not receive any. But the rule of thumb is by the NCC guidelines that we'll have you scanned 3 to 6 months after the last treatment to see how well that treatment has worked for you. If the response has been favorable and you've been progression-free for 12 months, then the treatment could be repeated as well. But this will be with discussions with your oncologist and the care team that's looking after you. I do want to say that this is a journey for us, and each institution's a little bit different. But what I do want to stress is that anybody that's been treated with us or in any institution, and this things that haven't met what you've required during that treatment and therapy, please email me or email the institution that you went to tell them where we didn't give you the best information, or where you wanted more information, or how we can help you do a better service for you. Because without the feedback, we don't know what we're doing wrong. So we really, really need your support to provide, the best service that we can to assist you or anybody new coming along. So we give you the best care and experience that we can. Okay. Thank you very much.